Hi everyone, my name's Sean Weaver, and today I'm going to be I did my presentation on missed nursing care as it pertains to the impact of staffing workload and the overall nurse experience level. And when I say nurse experience level, I'm referencing the years of experience that a particular nurse has on said unit. So, to start with, missed nursing care refers to essentially the required patient care that is either delayed, incomplete, or simply not performed at all. This is something that's pretty common in hospital settings, and honestly, something that I've seen firsthand working as a nurse. Usually, it doesn't happen because the particular nurse doesn't care, but more so when they are stretched too thin, when they have too many patients, or even not as too many patients, but more so the high acuity and the limited amount of time. Certain tasks start to get pushed back or missed entirely. This becomes a problem because care is directly linked to patient safety and quality outcomes. So, basic ADL tasks such as ambulation, hygiene, and patient education may seem basic, but when they're missed, it can lead to complications, longer hospital stays, and worse overall outcomes for patients. Based on this, the clinical question that I decided to do for the project was in hospital nurses, how do staffing levels and workload compared to adequate staffing affect this nursing care and patient outcomes over time? I chose this question because staffing and workload are constant issues in healthcare and they directly impact nurses and the patient. So, to answer this question, I use the following databases, including PubMed, which is a pretty popular one, CINAHL, and Google Scholar. And some of the key terms that I used to use in my search were missed nursing care, nurse staffing, workload, and patient safety. I limited my search to studies published within the last 5 years and focus on hospital-based nursing practice because that's what I developed my question around. In total, I selected 5 peer-reviewed articles, which include, again, both the quantitative and qualitative studies per the rubric. Okay, and moving on to the synthesis of the review here. Looking at the results from the literature, one of the most consistent findings is that missed nursing care overall is strongly associated with inadequate staffing and the overall increased workload as it pertains to the acuity of the particular patients. Because as the aging population gets, older and older, they develop more and more problems or more confounding comorbidities. And as a result of that, there's more things to do with fewer and fewer staff. So when nurses are responsible for more patients, essentially, again, they are more likely to miss essential care tasks. One study showed that basic care activities like ambulation, hygiene, and patient education are the most commonly missed when the workload increases. Another important factor that came up is fatigue. Longer shifts, such as 12 hours, which is what I work, and heavier workloads lead to decreased alertness, which increases the risk of missed nursing care and even adverse patient outcomes. I know for myself included is that my brain starts to check out around 4 or 5 p.m. and I have to basically be put forth an increased amount of effort as the shift goes on and on. Because you typically, for me at least, I discharge most of my patients by 1, 2 p.m. or not the elusive 10 a.m. discharge if you're at Gunderson, but I typically get a new set of patients around 1 or 2 p.m. or get a couple admits after discharging them, and then I have to learn them. And it's quite difficult when you've already worked 8 hours and you have to learn a new set of people. So essentially, it's not just about time, but also how mentally and physically drained the nurse is during the shift. I also found, too, especially with the retiring workforce, is that nurse experience level plays a role. Less experienced nurses are essentially more likely to miss care because they're still developing the prioritization skills and overall clinical judgment. They may not recognize what is most important in the moment, and especially in high acuity situations, because you don't know what you don't know necessarily. So it's easier to make mistakes if you don't know what you don't know. And that's why it's important to ask questions. However, again, it seems like most of the nursing staff are relatively new or less than a couple of years of experience. And ergo, if they don't know what they don't know, then things are bound to get missed. Beyond individual factors, the literature that I read through highlights system level issues. So in layman's terms, things like poor communication, higher patient acuity, and overall organizational constraints, such as staffing, all contribute to missed nursing care. This shows that the problem isn't just about the individual nurse, but about the overall structure and the environment of the healthcare system, such as typically just short staffing and running with a skeleton crew. Let's see here. The conceptual model included in the poster helps visualize this. It's pretty simple, but it just shows how nurse staffing and resource allocation influence missed nursing care, which then impacts, again, the quality of care, leading to adverse patient outcomes. So it's pretty simple, but I think it kind of encapsulates the whole issue. This reinforces that improving staffing is not just a staffing level issue, but a patient safety issue. And then based on these findings, there are several important implications for nursing practice. First off, improving staffing levels is one of the most effective ways to reduce missed nursing care. When nurses have manageable patient loads, they are able to complete more of the required care and provide higher quality care overall. But again, the problem is that, or part of the problem too, again, is lack of experience and the overall patient acuity getting worse and worse and worse. I feel like every time I work on an orthopedic unit, and you'd think it would just be orthopedics, but it's not just orthopedics. People come there with broken hips and broken knees, but they also have CHF, COPD, people are on BiPAPs, and they have also, and then when they come to the hospital, they typically haven't been to the hospital a long time, or they're a frequent flyer, and then more and more tests get run up, which lead to, again, increased complexity of the patient and more and more things that essentially need to be completed on a seemingly an orthopedic unit. So, second, supporting less experienced nurses through mentorship and training is important. Helping the new nurse develop prioritization and clinical judgment can reduce missed nursing care and improve the overall consistency in the care delivery. And another key implication is improving communication and teamwork within the healthcare team. So better communication can essentially help ensure that important tasks are not being overlooked and that care is coordinated more effectively. So things like delegation, using your CNAs, asking other nurses questions, and working as a team can help to ensure that stuff is getting done. And it's important to communicate. And I know that sounds, cliche and oversaid, but it's very important that gets done, because if you need help, it's important to ask for help. So, and then two, addressing nurse fatigue is also critical, as this can be done through better scheduling. I know we definitely have problems with this at my hospital. I feel like the scheduler doesn't like us. It'd probably be best to have someone who actually worked as a nurse or as a CNA or something like that make the schedule, because it seems like they just throw us wherever they want, especially the people that rotate between days and nights, because it's easier to plug it into a schedule. But when they're picking out the schedule, they don't necessarily take that into consideration, like working Friday, Saturday, Sunday night shift, and then coming back on Tuesday, Wednesday, Thursday for days. So this can be done through better scheduling practices and workload management. If nurses are constantly exhausted, the risk of missed nursing care and overall errors increase. And then finally, at least what I did when I was new, and what I still do too, is just using structured routines, checklists, and standardized processes can help reduce variability in care and make sure essential tasks are being completed. So using things like the MAR within Epic, I don't know, at least for myself, I write reminders to do X, Y, and Z, and I don't use my piece of paper at work. I essentially just use that brain when I'm plugging stuff in. And if I need to do dressing changes or get vitals or anything like that, I typically just plug it into the MAR and it'll give me sort of a schedule for the day. So in conclusion, the literature clearly shows that missed nursing care is strongly influenced by staffing levels, workload, and overall experience levels. So lower staffing and higher workload are consistently associated with increased missed care and worse patient outcomes, which supports the PICO question that I developed. And although many of these studies that were used were cross-sectional and relied on self-reported data, which limits the availability to prove cause and effect, the overall trends and my personal experience are very consistent across literature. So in conclusion here, missed nursing care should be viewed as a system level issue that requires the overall support of the organization, improve staffing and not running skeleton crews, supporting the nurse through orientation programs, and addressing the overall workload demands are essential steps to improving patient safety and quality of care. And then in my bottom right corner here too, you can see the references that I use. So thanks and appreciate your time and have a good day.